Secretary Eric Friedlander, thank you so much for joining us via Zoom here on Coffee Near Me. The big question is we're hearing about the efficacy of some test vaccines that sooner rather than later, those vaccines may be available in the new year. So let's do a little scenario. In the event that a vaccine became available next month, would Kentucky be ready to distribute it?
Yes. What we have to do, and what we had to do, was submit a plan to the federal government about a month ago that talked about how we would roll the vaccines out, which were the most important populations to roll vaccines out. There's like a 1A and a 1B sort of thing. So 1A, really, the folks we're going to roll out the vaccines to first are healthcare workers, frontline workers, obviously, and then the folks that are most vulnerable, right? The folks who are have some additional health risks, the people in congregate settings, those kinds of folks would be the first to see the vaccines rolled out to them.
So funding for this rollout, we know during the COVID-19 pandemic, as we speak, tax revenues are down. The state doesn't maybe have the purse it might have had. How is this? Because this is going to cost money. You got to have people who are going to vaccinate. You have to have IT specialists. There's a whole gamut that goes along with this type of project.
Funding is a challenge. There is some federal funding available, but so much goes away. So much of this doesn't directly relate to vaccines, but so much of the federal funding goes away at the end of December. So a lot of the testing we're doing, the contact tracing that we talked about earlier, we're going to have to figure out how to limp along until the federal government is able to help us with additional funding. So funding is going to be a challenge, but it's one of those things that we have to do. Right? We have to figure out how to get these vaccines out. And we have vaccine programs always. And I know that there are folks who are concerned about should they take the vaccines, but this is something that we need to do. This is, again, a duty, I think, that we as Kentuckians need to protect ourselves and our families. And this is the way to do that. And so far, what's exciting is the vaccines have high efficacy. They have been testing for safety. That's why it takes this time to roll them out, in part. The other is the science, but we've learned so much throughout the years about how to develop vaccines. This will be a record time.
We've also heard that during the pandemic, there have been racial disparities in who is affected by COVID-19, Latinx and African Americans in greater numbers. So that said, how do we look at the equity of distribution when we get a vaccine to certain geographic and racial areas?
Well, part of the reason that we've seen some of that disparity is that it's essential workers, right? Folks who have to go into work to help us, the folks in the front lines of healthcare, the folks in the front lines of essential services. We will need to roll out to those workers first. We have been intentional about where we place some of our testing, and we'll do the same thing with the vaccines.
So do we have any intel in the state of Kentucky as to once a vaccine is available, what that will look like?
We do. There are two vaccines now that look like they're going to be approved first. One is going to be more complicated than the other, and I do not want to downplay how complicated this rollout's going to be. Both vaccines require an initial dose and then a second dose after a period of time. That's complicated. It has to be the same vaccine. We have to hang on to who was vaccinated with what. And the other is that the first one that's probably going to roll out kind of needs to be stored at a very, very cold temperature. And so there's a life that it has after it comes out of it. Now, you can do dry ice and packing and things like that, but still it's more complicated. The second one, it is more like a normal vaccine, in terms of its life in refrigeration. So that will be easier to roll out, but both will be complicated.
And is there an area of the state that will get it first, or first come, first serve? What's that going to look like?
Oh, no, it'll be statewide. And like I say, the first will be for our frontline workers, our frontline healthcare workers, essential workers, those folks who are most vulnerable. That will be rolled out statewide in partnership with our hospitals and local health departments and healthcare providers, those folks that will help us with that initial distribution. Later, will be depending on folks like pharmacies and doctors' offices and our normal vaccination channels. But first will be primarily our healthcare and congregate care settings.
So Secretary Eric Friedlander, the Secretary of Kentucky's Health and Family Services, as it relates to a vaccine for COVID-19, is there light at the end of the tunnel?
Yes, that's what's so exciting. And we really are seeing that now with efficacy rates at the 90 and 95% level. That's fantastic. Now, we just have to make sure that we stay healthy and well and safe to where we can get those big rollouts. So we're almost there. We just need to have patience and perseverance, and we'll get there together.
Eric Friedlander, thank you so much for joining us here on Coffee Near Me. I'm Barbara Deeb. Keep the conversation going. Who would you like to sit down and have a conversation with? Thank you. Stay well.
Thank you. You too.